Good afternoon, everyone, and welcome to today's webinar. Today's webinar is Understanding Human Trafficking for Mental Health Professionals, and this is session 2, covering trauma bonding, coercive control, and vulnerable populations. This webinar will be presented by Dr. Sophia Jones, and this webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC. We're housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Katy Rivera, and I'm the project coordinator of the center and will be introducing our webinar speaker today. The Northeast and Caribbean MHTTC received 5 years of funding to enhance the capacity of behavioral health workforce to deliver evidence-based and promising practices to individuals with mental health conditions, and to address the full continuum of services spanning mental illness prevention, treatment, and recovery supports, and to train related workforces such as police, first responders, primary care providers, vocational services, to provide effective services to people with mental health conditions. We also always see supplemental funding to support school teachers and staff to address student mental health. The MHTTC provides training and technical assistance focused on evidence-based practices for people with serious mental conditions, including illness management and recovery, supportive housing, supported employment, and supported education. We also address comprehensive school mental health services and supports, wellness and recovery for people with mental health conditions and for providers, mental health and recovery among Hispanic and Latinx populations, and online self-paced education courses covering some of these topics. As a reminder, we deliver our free services by providing free resources, toolkits, online courses, training, webinars, and intensive technical assistance in both English and Spanish at no cost to you. If you'd like to keep up to date with all of our activities, we ask that you please sign up to receive our electronic mailings. You can sign up by scanning the QR code on your screen. And I will also share a link to our listserv in the chat box later in this webinar. Following this webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform our future training events. The survey is also important because our continued funding is linked to their completion, so we thank you in advance for your feedback and participation. We also want to let you know that a portion of this webinar, the didactic portion, will be recorded and posted on our website along with the presentation slide or any relevant resources. At the time of this presentation, Miriam Delphin Rittman served as Assistant Secretary for Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. We encourage you to interact with our presenter during this webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may pose questions to you, so please use the chat feature or the Q&A pod to answer those questions. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. We also like to remind you of the 988 Suicide and Crisis Lifeline for people who are experiencing suicidal ideation, mental health and substance use crisis, emotional distress, or if they are concerned about someone in crisis. Now let's begin our webinar. We have with us Dr. Sophia Jones. Dr. Jones is a training and consultation specialist with the Rutgers Behavioral Health Research and Training Institute for the Children's System of Care Training and Technical Assistance Program. Dr. Jones has over 18 years of experience in the behavioral health field, specializing in culturally competent focused crisis intervention and service plans. She brings years of experience working with children and families diagnosed with mental illnesses from the New Jersey System of Care. Dr. Jones continues, to advocate for health equity and equal access to mental health services. She specializes in healthcare professional and corporate development training programs focused on working with families living in poverty, health disparities, health and public policy, anti-racism, human trafficking, cultural competence, implicit bias, effective team building, diversity, equity, inclusion, and belonging, the culture of hip hop, developing rapport with children and families, and safety in the community. Dr. Jones earned a doctorate from Seton Hall University and is a strong advocate against human trafficking. At this time, I'd like to again welcome everyone, and I'll turn it over to Dr. Sophia Jones.
Thank you, Kathy. As always, I appreciate your kind words, and also to just kick us off with all that information so that our participants today are prepared to engage. You should be seeing my screen come up, and with that, we are moving right into workshop number 2, which is trauma bonding, coercive control, and vulnerable populations. So what we're going to do today is piggyback off of the information that we shared in our workshop number 1. And that involved talking about organ trafficking, sex trafficking, and labor trafficking. I know that many participants were kind of in shock about some of the things that can happen to our youth and families. This sometimes, even in my own opinion, comes as a shock to me, because I just can't realize why in this day and age we have people who would like to commit these heinous crimes against these vulnerable populations. So we're going to go through information that will assist you in understanding the trauma bonding, the coercive control, also how there are specific populations that are most vulnerable, but again, touching on the fact that we cannot include bias, assumptions, or judgments when it comes to specific groups and populations. One thing that I do want to cue you into at the end of our presentation today, I'm going to talk a little bit about the laws that have been enacted to address human trafficking. But for today, we're going to talk about the dynamics of coercive control. This is something that needs to be laid down in terms of the foundation of how this happens, especially for clinicians and healthcare professionals, because they often don't understand why, if I'm explaining to someone that you are being exploited and that someone is taking advantage of you in many ways, that you can come and be free of this person. This sometimes comes at a pace that is not fast enough for clinicians and healthcare professionals, but to have a deeper understanding of what coercive control is will help you in your service planning. We're also going to discuss trauma bonding. We're going to identify some of those vulnerable populations that are often exploited. We're going to look at some of the harsh realities of human trafficking. Where have we gone since the enactment of some of these laws? But also, what are some new ways that people are trying to recruit the most vulnerable populations? And then we're going to talk about risk factors. So this is a moment for you to think about, hey, I'm working with this group of individuals, ages 11 to 14. I know that from our workshops, we have discussed how this can be a vulnerable age for them. This is an age of development, brain development, right? And how are they processing all the things that are coming at them in terms of social media and other stressors? So let's begin to talk about domestic violence and sexual abuse. I know that some of you have a background in domestic violence, and it's very important to note how they often will overlap. When we talk about this intersection, we're really referring to how there's this power imbalance, and that power imbalance occurs often with power and control, an intimate relationship. In domestic violence, you will often see children that are involved. I want to bring this to your attention, especially when we talk about children, because you may also have a victim of trafficking that has children with their pimp or the person that has been violating them for years. This, again, is a method for coercion to make them do what they need to be done, whether that is commercial sexual exploitation or to participate in labor trafficking, because now they have a child together. The sexual abuse comes into play, and that intersection comes into the conversation when we talk about looking at someone as a sexual object. There's also the grooming process where you may have people that they're very close with, that will have conversations that are centered around items or things that they will say they have in common, but in actuality, this is a grooming process. And then this can often end in conflict and violence, where there was an understanding that you were going to be a love interest or someone that was going to take care of me. And in actuality, this is now a setup for me to be trafficked. Now, when we think about this whole idea of the individuals who are the pimp, and I'm going to say pimp, or I'm going to say people often will refer to them as sharks because that's exactly what they are. They are masters of manipulation. And when we think about the people that are preying upon our youth, it's very difficult sometimes to understand how they will target a specific population or group. They will try to meet their needs. In many instances, they will be the person that says that they love them. If you have someone who has low self-esteem, this could play a huge part in their moving into what is often considered a stable. You will have physical harm. They will manipulate them. They will say that they are under their control. They also have a way of brainwashing individuals to believe that their family will not accept them if they divulge that they have been with multiple Johns throughout the day. So when we talk about this in this context, it's important for us to understand that when we start to have dialogue in either a clinical setting or if you come into contact with a individual who's being victimized, that we have to understand that they are dealing with someone that is a master of manipulation. The other piece that I want to kind of tie into, because we often have this framework, especially when we think about people migrating to this country, is that there is a huge opportunity for individuals to come here and to work in environments that are safe and able for them to provide resources for their family. Unfortunately, some people who will say that they're going to sponsor them or provide them with support can also manipulate them, right? And they're relying on the sponsorship, even when they're in these detention centers, or they're relying on connections to resources to take them out of that situation. So when we talk about these acts of manipulation, I don't want this to be limited to just one group. I understand that this comes in many forms, especially when they come into contact with someone who is concerned about working in this country, or maybe there was a conversation about documentation and finances and cash to work in a specific field or work area, and now that narrative has changed. When we talk about young adults, it's going to be important for us to understand the process at which this happens. And one thing that is very important for anyone who is beginning their research about human trafficking, and I often say this because in the time that we are together in these workshops, it's not quite enough to have a full understanding of how individuals are manipulated. Often this comes in the form of recruitment, seduction, isolation, coercion, and violence, and then reframing. These victims are often targeted, they're tricked, they're traumatized throughout the process as well. And this is important to note because it will not just come in the form that I'm listing, but it could come in different ways. It could be that there's no recruiting because I actually know you, you're a person that I'm related to, or there's a form of intimacy. There can be from that point isolation, but we do want you to have an understanding of how this plays out. Now, when we talk about recruitment, often when people hear the information that was given in workshop 1, and we start to transition into information about workshop 2, this will often occur in many spaces. And so I don't want you to believe that this is the only list of areas where individuals can be recruited. When we talk about recruitment, we also want to cue into this conversation that needs to be had within schools, because schools have been a breeding ground for recruitment for human trafficking. It could be in the form of a peer that approaches them to come to a party. It could be in the form of a group of adults who try to manipulate youth into participating in gymnastic teams or other programs that are not attached to the school, but the process starts with conversation within the school and the playgrounds. There's also an opportunity when you have someone who has a history of addiction or substance abuse. There's a history of being trafficked multiple times, especially if that person has been previously trafficked. So here lies an opportunity for anyone who's working with youth and families to have an understanding about what is their definition about trafficked, right? Is it that they have this relationship with someone who is extremely older than them? Is there conversation that is centered around going out with someone who's new to the school or continues to be present in the school for activities, but they are affiliated or not affiliated with other sports teams or other organizations within the school? The other thing that we're finding out is that there's a lot of recruitment within out-of-home treatment centers, especially if you have a history of youth being in the foster care system or being part of the child welfare system. Often when victims of trafficking are in survival mode and talking about their experience as a youth, they will note that they were part of the child welfare system. So here lies again an opportunity to begin to have these conversations within our out-of-home treatment centers to talk about what trafficking may look like, to talk about the fact that sometimes you have youth that come into these programs and they automatically begin to bond with other youth in a way that is not healthy or promising in terms of their own treatments. Now, when we talk about seduction, seduction can come in many forms. I think sometimes people often think that seduction comes in the way of conversation and that the trafficker will manipulate them into coming to these spaces through, kind words. And that often does happen, excuse me, but it also happens in this framework of buying items, giving them cell phones, telling them that they love them and that they are, not going to be able to live without them. And this comes in the form of relationships. And that relationship allows them to build the trust that often switches and transitions into violence. And so the seduction piece, I also want you to be mindful of, takes time for some, but it can be quick and it can be fast. It could be a week, and some survivors of trafficking say, well, actually, the seduction piece was very long and it took time for me to trust them. And that was unfortunately, unfortunately, it did not end well for them, but the seduction piece can take longer and be based on that individual. Now, when we talk about isolating, right, this is often done so that there's the continuing chain around the brain, right, where you are removing all the safety nets for youth. Okay, so if I isolate you, now you can't come into contact with people that may have a conversation with you about the dangers of human trafficking or the dangers of being alone with someone that you're not familiar with. And they will also put into play the shaming and blaming, right? Where if you tell someone, look at the shame that you're going to bring to your family, or they will blame you for being in that situation to begin with, right? This often occurs, especially when we talk about the shaming piece, and people often make reference to this when we talk about different cultures, right? So this conversation of your family will not accept you. It's not wise for you to go back to that situation. Look at the shame that you've brought upon not just your family, but your community and also your culture as well. Now, during this phase, it's important to note that at this point, you will have the trafficker putting into motion this idea that you need to be completely reliant on me. And this again sets these individuals up for being trafficked in one city, possibly moved to another state and into other areas within the United States and throughout the world. Now, the coercion and violence often comes into play because there's this idea that now that I have coerced you into this space and I'm providing you with these items or things, that this is actually a place where you can feel that you are wanted. And now I'm going to give you this idea of a glamorous life. But after that phase is done, then there may be continuous violence. If you are listening to this call and you are part of a hospital or medical facility, this is where we have to have our mind in tune to those injuries that I mentioned in a workshop one that says, do the injuries match the type of work that this individual is saying that they are doing? So this is, again, going into that space of understanding coercion and then transitioning into violence. Now, I also need you to be in this space of thinking about the type of violence. It could be physical, it could be mental. There's a promise of a new life and moving forward, but for them, it could be this conversation about control and power. And now I am your daddy, and this is your family. And they are, again, being coercive in this conversation. But if that person does not say that they want to be a part of this family, or that this isn't exactly what we discussed, that's when the violence can come into play. Now, the reframing part is the piece that often people can't quite sit with. Like, well, wait a minute, you just finished saying that someone has been manipulated and they have been coerced and then there's violence. Well, reframing that to say, listen, remember, I bought you these items. So I'm going to reframe this idea of you being abused and violated to you're actually in a space that is safe, that you're around people who actually care about you. And this cycle can repeat itself over and over and over again. And so when we start to think about trafficking and how it happens, absolutely it's important for us to understand the forms of trafficking. Absolutely is it important for us to understand how someone can get themselves into that situation where they're having these conversations, but to pull back and also understand that there's the reframing. Now, I also don't want this to ever be a place where there's a blame on the victim. So I don't want it to be, processed as, oh, they got themselves into this. I want you to understand that, unfortunately, we have youth, especially with all of the pressures in our society, that are looking to be loved, that are looking to belong. And when you have people who are masters of manipulation, this can result in trafficking. Now, I'm switching a little bit into the understanding of how the internet comes into play, social media and gaming in particular. When we talk about gaming systems, often this is a way that more males are being recruited into human trafficking. That doesn't mean that there aren't people who identify as women or female aren't being recruited, but this is a way to connect, and it's impersonal, right? There's a space there where it could be recruitment and it could be faster, right? There's a space there where they could say that I am of one age, but in actuality, they're not. You have information that's posted online, right? You have an opportunity for people to deny who they really are. And in this space, there's opportunity for someone to give personal information. You know, their tagline may be their name, part of their school, their age, right? So these spaces that are created are actually opportunities for people to have conversations that lead them outside of their door to meet, to engage in conversation, and that can be also part of the grooming process. Now, what's happening in, this idea of being virtual, right, is also opportunities for human traffickers to say, you know what? I'm going to meet you in the metaverse first, and then you're going to be trafficked. So you have incidents where youth have been meeting with individuals that will be potential Johns, and then they will have face-to-face meetings with them. So I want you to kind of sit with this idea of the use of the internet, absolutely, but also the use of social media, gaming systems, and also the metaverse. So as we continue to progress in terms of our technology, that also has given traffickers an opportunity to use that to their advantage. Now, something that's brought up often is Stockholm syndrome, right? And this not to say that this isn't true, because this does happen, right? Where there is this disconnection, right? And there's this bond that occurs. And so for us to kind of have a deeper understanding, absolutely, we need to understand what trauma bonding is and what Stockholm syndrome is. Now, this often occurs in a situation where there's physical or psychological isolation for that victim. You know, isolation plays a huge role in this conversation of human trafficking, because that is where they get the victims to this space where you're relying on me, and now I can change the narrative of what is actually really happening. So you have that threat, you have that, physical and or psychological things that people will do to survive, right? But that's combined with the kindness of the trafficker. So in one instance, there can be a repeat of beatings and verbal abuse. And then in the other instance, there could be an act of kindness or a purchase of items. And so this is why we have to be mindful of how we approach victims of trafficking, so that they and you as a professional, healthcare professional in any realm, have a deeper understanding of how they can be physically and psychologically trapped. Now, I want to talk a little bit about trauma bonding in the next couple of minutes, because it's important for us to have an understanding of how this also can impact a youth. And the love bombing phase is something that often happens where there's this intense conversation and there's this idea that we are together, that we are together. In some instances, they will say, together we could tackle the world. This is how much money we can get together. When in actuality, the victims are not given any type of compensation. In most instances, in conversations with survivors, they have been manipulated at many levels, where their credit was ruined. They have multiple names. So all of these things come into play, where they will say that we are working as a unit, when in actuality they are manipulating them. They are using their name to open up accounts. They have put them in situations where they now have criminal records. So this comes out in the bonding phase. When we talk about trust and dependency, this again goes to the point where, you have to trust me because I'm the only one that's going to be here for you. And this level of dependency can be to the point of access to food, access to water, access to any type of contact with family, right? So this plays out in multiple ways, in different ways, depending on the trafficker. The manipulating and gaslight is one thing that we really have to pay attention to, because this gaslighting of thinking that, well, maybe I am to blame, and that there is some behaviors that I didn't notice before, that you're buying in as a victim to the conversation that you are actually the person to blame for the situation that you're in. The resignation and giving up is very interesting, because there's some research that shows that sometimes it's not so much they are giving up, but they're trying to appease the trafficker because they don't want the abuse. They don't want the violence. They don't want to be abused any longer. And so in order to navigate that situation, they feel that I will just appease them and do what needs to be done. But I realize that this is manipulation. I realize that this is a chain around the brain that is not allowing me to be free and to move like I normally do. The sense of loss of self, right? Sometimes that can also be a coping mechanism, because here I am in this situation that I can't get out of. So maybe if I lose myself, if I start to not think so much about what is happening, if I just kind of move in this space where I'm disconnecting, then maybe this will move past reality, right? And the addiction to this cycle comes into play as well. Now, when we talk about these stages of bonding, again, I'm going to go back in. I'm going to remind you that each individual that you are working with is going to be different for them. So your treatment plan, your service plan, your plan as an organization should be unique to that individual. I want to go in a little bit and talk about debt bondage. I think that it's important for us to not only sink in with some of the definitions that we talked about in our workshop 1, but also flow into this idea of what does debt bondage look like, right? Because now you have this framework that says, well, there's a process, right? For the grooming, for the seduction, the isolation. You understand that, right? And then there's a process when we talk about trauma bonding. But now we're saying you have a debt that needs to be paid. And that comes into the conversation as well. So this is often a frequent ploy that is used, as intertwined with the bonding. Now that I have reframed this in a way that says that you have all of these things that I've added in this we conversation, I'm also saying that because we're together, that you now owe me because of the things that I've been able to offer you. So you have these controls of the victims of sex and or labor trafficking, that control measure. You have the promises of economic opportunity, especially from individuals that may come from other countries, that there's this idea that if you come and work, which you probably do in your place of origin, now I'm going to compensate you. But wait, you owe me for that transportation. You owe me to be able to live in this house. You owe me to be able to wear those shoes or clothing items, right? That comes in this space as well when we start to talk about the manipulation, right? So I'm put here, that is common in agricultural work, but by all means, it happens in all forms of trafficking. Okay, so we want to talk and dig in a little bit into the cycle of complex trauma. I think, when we talk about this, and you're going to receive several references that dive into this cycle of complex trauma. And I thought it was, appropriate for us to have this diagram so that you see that it's cyclical, right? So, traffickers are very, very manipulative, but you will have victims that will often experience a positive feedback loop. And this positive feedback loop of effects is often triggered, right? It's triggered and it's highlighted and it's heightened when they're in this chronic phase of trauma. And so you see that they are very vulnerable. And now they may even go into this space of, listen, I'm feeling very, very vulnerable at this point. And I'm thinking about the trauma that I experienced. And I have different layers of anxiety. I have different layers of depression. And I'm not able to kind of hold on to my emotions. During this phase, we've often talked to individuals about the level of trauma that they experience. And they will say, in many instances, I would even reenact the way that I was treated because I thought that that was the norm, right? So take a minute, look at this diagram and just start to think about how complex trauma can be for someone, and that they're navigating their feelings and they're trying to get to this space of comfort. Now, this also reminded me of the language that we need to use when we are dealing with someone who has experienced a traumatic event. I'm not one to try to promote books and things of that nature, but it's important for us to reference some books that will allow us to have a deeper understanding of trauma. And one book by Dr. Bruce Perry and Oprah Winfrey goes into this idea of the questions that we need to ask. And when we have someone who is a victim of trafficking, to talk to them about what happened to them. And so it's important for us to have that deeper understanding. Now, and thinking about this goes back to many of the terms that we have discussed, especially when it comes to trauma. Victims of human trafficking, they will often stop in this phase of flight or fight response. And so this is just to give you a recap as to what often may happen, right? What phase are people in, right? Now, we often give that example of a bear in the woods, but think about being put in this space of contact with someone that is able to manipulate and is able to put you in a space of extreme vulnerability. And so as you are developing these plans, we have to be mindful of these phases, right? And how often in the literature it points that victims will often go to this fight or flight response. So the first time, the second time, even multiple times when you bring up the conversation about what happened to them, that this may be their response. Okay, so we also have to remember in our planning that victims are expressing trauma differently. So they may disassociate. You may see bedwetting. This has come up often in conversations about, having nightmares and feeling very disconnected to the people that are trying to help them. So that also comes in that form of reenactment that we talked about. Now, we are going to talk about resources and supports, but when you have someone that is healing, we have to understand that we need to create a safe space. We need to take the time that is necessary to support them. And we need to understand that this is not something that is going to happen overnight. Now, if you're following through, we've been talking about, things that are happening, and we're talking about this slide after slide, right? But think about how someone can be in this space of being victimized and told what to do, how to do it, how many jobs to serve, how many hours to work in these conditions, right? For multiple years. So if you are sitting back and thinking about how long your plan should be, it's going to take time for victims to get to that space where they can actually talk about what has happened to them. Now, we mentioned in our objectives vulnerable populations. Now, what often happens with me in conversations, whether it is with attorneys or agencies or organizations about trafficking, is we do not want to put labels on individuals, in particular, people who identify as part of the Black and Brown community, as the only people that are victims of trafficking, because we need to understand it does not discriminate, but we also don't want to try to put the labels on certain communities and individuals. And so that brings us to this conversation about who may be vulnerable. It is not to say that if a person is living in poverty, if a person is having mental health concerns or low self-esteem or struggling financially, that they cannot be a victim of trafficking. What we don't want to do is say that only certain individuals can be victims of trafficking and only programs should be geared towards those individuals. That is where we have multiple conversations about what needs to be done when we talk about trafficking. So that being said, we are not blind to the fact that there are groups that have been historically marginalized. And because of that, you have individuals that identify as being part of Black and Brown communities, the LGBTQ community, persons with disabilities, often people who have migrated to this country if they have language barriers, right? You have individuals, especially youth, that may not be accepted within their home because they have begun to question their gender or gender identity. And this puts them in a very vulnerable position if they are gone missing, and if they are seeking food or seeking shelter, right? If you have a persons with disabilities and someone in the family is not quite sure how they're going to pull their weight, for lack of a better term, what does that mean? That means that they can exploit them through video cameras and performing certain sexual acts on them. So we have to be mindful of the groups that are often extremely vulnerable to trafficking. And I talked earlier a little bit about migrants and individuals that may come into this country and they're not quite familiar with the language or the culture or the process that happens in the United States in terms of exchange for services or goods. Now, I mentioned a little bit about the LGBTQ community, and I think that in my experience in working with this group that, families, absolutely, there are families that have been very welcoming to individuals in their home and in their children, of course, who are questioning their sexuality. But when you have families that may not be so welcoming and do not want this type of dialogue within their home, we need to be extremely supportive because they are more at risk for being homeless. And there are concerns about transitioning as well in their health and overall well-being. We mentioned too a little bit about persons with disabilities, right? So we have to make sure that we are creating space for that conversation. Law enforcement and court systems have been in a space to have conversations about all the groups that we are talking about. So it is for us to be extremely supportive when we have someone who identifies with any of these groups, to be mindful that first and foremost, it could happen. And then the idea of not having a conversation puts them in more of a position to be vulnerable. Often when we think about a person who has a disability, we think that those disabilities are something that we can see, but we also have to understand that there are abilities that people have that go far beyond our imagination, but there's also persons who have disabilities that are not very obvious when you talk to them. So how important is it for us to have these conversations that are inclusive and that are understanding that these people are not discriminating and they will search for people who are not considered a viable person to testify in court, or that they may be easy to manipulate. So this kind of brings us back to the conversation that we kind of intertwined in with the vulnerable populations when we talk about youth in foster care, when we talk about the child welfare system, right? This is not to say that these systems and the people that are working on in these systems are to blame. It is to allow us the opportunity to reflect on how these systems have evolved over time. And if you have someone, and in many cases, I have worked with families who are giving care and support to an individual through out-of-home treatment centers or through the child welfare system, and foster care parents as well. And when you have a youth that has been transitioned through 4 or 5 or 10 foster care programs, or they've been part of the child welfare system for many years, they start to normalize this. Because they start to normalize being an object and move from place to place, it makes it easy for someone to come in and have a conversation about being trafficked. When you are not involving someone in their life decision making, right? When you're not allowing them to be socialized in a space that is healthy, this is where you have opportunities for individuals who are wanting to traffic these vulnerable groups that can come into the conversation, that can try to change the narrative. Now, let's flash back to when we talked about the push and the pull. right? When we talked about the push factors, right? This is where we have to sit with these individuals have a high risk of being trafficked, especially when we start to talk about unrest in specific countries, or you see that there is extreme poverty, right? Because in our minds, sometimes we think extreme poverty, it can't be happening here in this country. But in actuality, absolutely. People can be struggling. People are struggling out here. And what does that look like for them? If there's an illness in the family, right? If we delve even deeper into a history of domestic violence, what does that look like? And then the pull factors say, absolutely, you can, come work for me. Look at the things I can offer you, right? I can change your story, all right? The reason why I want you to do that is because I want you to also recognize that having a connection and understanding of the push-pull factors brings us to this conversation of the barriers that are very present for victims, that I'm not going to just stand up and self-identify. I may be confined or monitored on a regular basis, right? What you do, where you go is constantly monitored, okay? If your identification was taken from you, right? Wait a minute, I'm going to put this in a safe space for you, when in actuality, they're taking their ID or passport. If there are constant threats and violence, not only am I going to do harm to you, but I'm also going to do something to your grandmother or your loved one or your parents or your siblings. If they feel that I don't have much support, especially after this conversation with my trafficker, then they may feel that they have limited family. And the other piece too that we have to understand that can be a barrier is that now that I have been sexually abused for years, and this could be from someone in their family or someone that they're close to, they may feel like, this idea of having sex is normalized. It has been the way that I have been surviving in this home or in this community where someone has been violating me for years. Now, when we talk about this and these barriers, you should be thinking, absolutely, there's barriers, but now I need to do additional work to try to establish the trust so that it starts to balance where there isn't as much fear. So we talked about this false promise of a future, but I want to remind you of that, right? There's this false narrative that, you're going to be a singer, you're going to be a dancer, or when you come to this country, you're going to be a big star. Or when you come to this country, or if you move from this city, because I don't want it to be that, oh my gosh, we're only talking about crossing the border, right? It is also being done in this country, right? And so this shame and self-blame and help and hopelessness, right? This comes into play as well. You often have this idea too that I can't trust anyone else, that no one will understand if I actually explain this to someone, right? Which is often the case because this conversation about trafficking, often people either don't want to hear it or they don't want to come to the realization that it's happening, and it could be happening right there in their neighborhood. The language and social barriers that could be in place, and especially in working with youth, if they feel that I've already been in trouble with the law, or I have other charges or a criminal record, that who is actually going to believe me, right? Because I have a history in this community of breaking the law. So here is where we start to think about what can we do, right? That we need to approach this in a way that is absent of unconscious bias. We need to have conversations with our youth. And if you are in a space to have a conversation about someone who is a victim of trafficking, we need to pull away from the idea that this only happens in certain neighborhoods and among certain groups. We need to really start to think about and treating individuals like what they are, and that is potential survivors. That we need to move away from treating individuals that are victims unfavorably just because they have identified with a specific group or a specific culture, or that they have identified with a specific gender. Now, when we talk about engagement and empowerment, right, I think that this is important for us to make sure that we are in a space that we could have engagement. Now, this isn't always possible. We may not be able to have a conversation that is one-on-one, especially if they are with someone that is constantly shadowing them, that is making sure that they stick to the script and say certain words. So we have to be creative in our approach. We have to make sure that we are savvy in our movement. Maybe you have to pull them into another room and have a discussion about this away from their trafficker or away from someone that is working with the trafficker, right? We have to be mindful of our environment, whether it's a hospital or other facility, where we want to pull them into a space and say that maybe we have to perform another examination that needs to be done privately. So we have to be creative in doing that. We also have to work to establish a level of comfort and trust, right? Be clear about your role. Don't say this is going to be between us, when in actuality, you know that the protocols for your organization is to make sure that we establish a team and that we have this conversation. But you're letting the victim know that these are my first steps, second steps. These are ways to engage so that now you have an opportunity to build trust. The other place that I want you to come to as you start to process workshop 1, you have this idea of what the trauma bonding looks like, right? Is you want to meet people where they are, right? We often talk about this in mental health because it's so important to meet people where they are, to not judge people by the fact that they have been in this space for multiple years, or that they felt that the only way to not have the trafficker inflict harm on their family was to move with them, right? We're moving past this judgment and labeling into this idea and conversation about ways that you can empower them. So again, back to that strict confidentiality. Listen, I think that this is a conversation that we're having, and I'm glad that you trust me with this information. But in order to make sure that I can help you in the way that is necessary, I'm going to invite a few other people into the conversation. And also go to them and ask, is there someone else that you trust that you want to be part of the conversation? But you want to, under all circumstances, to let them know that they have options and that there's resources. But in order to do that, you also have to have a plan. Some other recommendations, right? To acknowledge that this actually exists, to collaborate with different systems, to go back to the information that we talked about when we think about red flags and what they look like. If this happens where someone leaves and they've gone missing, what does that look like? Well, that looks like we need to notify anyone and everyone that's involved and say, you know what, someone's missing, and we need to do that immediately. If you are a leader within your organization at any level, you need to go back and look at your protocols for training. What does that look like? Are we all trauma informed? Are we taking as many trauma informed classes that we can? We have hotline numbers, which we have also provided for you in the handouts. You'll get that as well. You also want to invite you to be part of the conversation. You want to make sure that if you have them in your program and they're receiving support, that there's a consistency when it comes to the therapy, when it comes to the conversations, when it comes to the support groups. They have to be consistent. Now, when we talk about mental health, there are often many concerns. It can range from anxiety, depression, They can focus on the somatic symptom disorders, excuse me, where there's a focus on physical symptoms, right? They have so much pain or fatigue, right? So you imagine, days of not sleeping. That's also part of the manipulation, right? Being sleep deprived. If they sleepwalk or there's some type of disruption or impulse and control, conduct disorder, right? Acute stress disorder or PTSD. But I don't want you to kind of sit just with those diagnoses. We also have to understand that when you come in contact with a victim of trafficking, that there are other concerns that need to be addressed. There are the physical, there is the educational piece. If you haven't been in school for 7, 8 years, how do you transition back into school? There's the emotional piece. What does that look like? There could be multiple STDs and STIs. So there's a lot for you to unpack in terms of your planning. But as you are doing this, as you are addressing all of these things, we have to be mindful. Sometimes people don't want to talk about the spiritual aspects, right? Sometimes people don't want to go down that road. But if this can be a way that you can support individuals, by all means, tap into that. We got a couple of minutes, and I know I'm on the clock here, but I want to make sure that we have an idea of what is actually being done, right? Commit yourself to have an understanding of the laws over the course of many years as human trafficking has come into the spotlight. There has been changes about the laws, but the Mann Act came in 1910. In 1970, you had the racketeering or the RICO Act. And I think the last time we talked about in the workshop, I might have said 2010, but in actually 2000, you had the Trafficking Victims Protection Act. And this is important for us to understand because this actually was an opportunity to create laws that would address international victims. But then when we started to move forward in 2005, now it started to add in more about domestic victims. Prior to that, you had the Protect Act of 2003, and you saw recognition even at a federal level in 2010, where there was a declaration of Human Traffic Awareness Month. So now you have yearly opportunities to engage in conversations centered around human trafficking. Now, if we look at prevention, right, and especially in New Jersey, and often I'm going to go back to what is happening in New Jersey. This is where you have in 2013, where there was this kind of opportunity to say, listen, you cannot consent, right? Because again, if someone who has been manipulated for years, they believe that this is the way it's supposed to be. And then you have the other act here in 2014, the Preventing Sex Trafficking and Strengthening Families Act, right? So now there's continuous opportunities to try to reduce these incidents of trafficking, okay? So when we think about trafficking, I want you to sit back and say, what are some of the things that you can do, right? Because we have laws that have been put into play. We also have this better connection and understanding of what the trauma will look like, what the grooming process looks like. So for you now is the question of what else can be done. You may not feel that, okay, I could tackle everything, but think about your team, your circle of individuals, and what can actually be done. So I want to thank you for coming into this space and talking about the trauma aspect of human trafficking. And this will conclude our workshop number 2.
So again, thank you so much for joining us. As part of our training evaluation, we are required to provide you with a brief survey regarding today's training event, and we appreciate your honest and open feedback with us. We also would like to let you know that we have a podcast for helping professionals. It's called Flourishing at Work, and you can search it in Spotify, Apple Music, or Podbean, or wherever you get your podcasts. And so many people in the chat box are so grateful for your wonderful knowledge and sharing. So if you missed session 1, it is posted on our website. You can either go to our website or scan the QR code, and it'll take you directly to our products catalog page, and you can access the webinar recording as well as the presentation handouts. Just a reminder that I will be emailing, we generate certificates of completion within 7 days of this webinar broadcast, and everyone will receive a link to the recording and the presentation handouts that are posted on our website within 7 days. And again, we invite you to connect with us on our social media channels, either Facebook, Twitter, or LinkedIn. You can follow us at our handles that you see on your screen. And again, I just want to thank Dr. Jones for being with us today. And I will also share the evaluation link in our chat box.
Thank you for having me. Thank you so much.